Thank you for inviting me. Today we talked about the methodological challenges in complex intervention. I would present you and to end this session with a specific aspect is the use of scientific knowledge by policymakers and practitioners, and give you 2 or 3 words about the knowledge transfer strategies to help this use. As my colleague said just before, we have a definition of interventional research, one of several definitions. It's population health intervention research involves the use of scientific methods to produce knowledge about policy and program interventions that operate within or outside the health sectors and have the potential to impact health at the population level. As François said, the aim of interventional research is to inform decision-making and practices to be disseminated or scaled up. But it's a kind of research very complex to implement, complex to evaluate, complex to understand, and obviously complex to disseminate. The reason why this research is complex is for 4 reasons. The first is the diversity of research objects, because in interventional research, specifically in public health research, we have to work with behaviors, many behaviors, care system changes, and effects from regulation and other subjects. And we have to manage many levels and many frameworks to understand how these interventions work. The second reason is the instability of parameters involved in the outcomes, because we have to work with a dynamic and unpredictable process. The third is the role of an uncontrolled context. As François said just before, an intervention makes sense by interacting with the context. It becomes a complex system and needs to be evaluated as such. And the fourth is the diversity of focuses, because we can assess health outcomes, but also we have to assess ethical characteristics of interventions, of public health interventions, sustainability of them, and feasibility and transferability in real conditions. So it's a kind of research which leads to complex evidences with many properties which are not always comfortable for decision makers, practitioners or policy makers, because these kind of evidences are not always available, not always accessible, with not the same quality and credibility, because we have to manage different sort of designs to answer the different questions François said just before. These evidences are not able to meet needs of policy makers. They are not always provided in due course, and they are not always transferable and adaptable in the different settings where policymakers and practitioners work. So it's a rounding of the characteristic of this research, but on the policymaker side, it's also complex, because they have to manage different parameters to make a decision. The decision-making is not always from a rational and linear process. It's not always synchronized with the time of research, influenced by multiple sources of knowledge, and combining influences from many stakeholders in context. It's more like a cake, not a rational process, and to do this cake, we have to manage many parameters, many ingredients in the recipe. One of them are decision makers' characteristics, especially the beliefs or personal values of policymakers, which can influence the decision, the social demographics and level of education, the previous experiences of using or not knowledge, scientific knowledge in their decision, the level of motivation, the ability to interpret data coming from science, the involvement in the policy, the perceived importance and scope of the program, the determination and personal interest in the use of scientific knowledge in decision, the likelihood of the knowledge, and the public acceptability and the media influence according to the innovation we want to implement. So these characteristics affect how decision makers perceive the interest of the innovation existing system and perceive the complexity and the feasibility and the transferability of this innovation in the context. The second category of characteristics influencing the decision is the organizational characteristics, especially the open-mindedness regarding the change of the organization, the researcher-user interaction practices, the material, human, and financial resources available for change, the type of management and leadership, especially the bottom-up approach of the management is more influencing the use of scientific knowledge in decision. If there is a supportive external environment, especially stakeholders coalition for the use of knowledge, and the norms in the organization to facilitate the use of scientific knowledge in them. There is a range of influencing actors entering the decision-making process, considered as a negotiation process, mobilizing, obviously, multiple sources of data, evidences, of course, but also testimonies, experiences, contextual data with the same value in the point of view of decision makers. So these different sources influence by a rational way or an emotional way the decision. These actors are guided by their own interests, only own interests. They're coming from public or private sector, involved or not in policy process, but intervening in different levels and moments in the policy-making processes. If we consider the policy cycle, we have 4 steps: the agenda setting of the policy formation, the policy implementation, and the policy review. And these different actors intervene in the different steps by synergic action, antagonist action, the exercise of competing interest, and by putting favorable or disfavorable conditions in the implementation of the policy or the practice. So we have a gap between research on the side and policy making on the other side. The characteristics of research are the changing and uncontrolled context, the instability of parameters, the diversity of focuses to take into account, and the different nature of objects. On the policy decision-making side, policymakers want a useful evidence, an adequate evidence, an opportune evidence, and a transferable evidence. So how to reduce the gap between these characteristics, between these 2 words? We can use the knowledge transfer strategies, defined as a group of activities and interaction mechanisms that foster the dissemination, the adoption and appropriation of the most up-to-date knowledge possible for use in professional practice and in healthcare management. Langer and his colleague has done enormous work, 450 pages we analyzed, to determine the most effective knowledge strategies in the use of public health scientific knowledge. These mechanisms are the awareness, the agree, the communication, the interaction, the development of skills, and the structures and process. The awareness, I can read. Excuse me. C'est bon? Excuse me, I can read my my slide. The awareness is by building awareness and positive attitudes towards evidence-informed decision-making. We can use different techniques to create these mechanisms. a co-creation of research projects, the knowledge brokering, the building norms to use evidence, the showing the effects of non-evidence-based practices, and the advocacy on evidence-informed practices. These strategies are effective when they are combined with other mechanisms. The second mechanism is called agreement or agree, by building mutual understanding on policy-relevant questions and the kind of evidence needed to answer them. We can use different techniques: collaboration between researchers and practitioners in a specific theme, in a specific project, the consensus building techniques, especially participative leadership, feedback, and panels of experts, and the collaborative learning, especially interprofessional education and journal clubs, to analyze and to identify the transferability of evidence into practices in real conditions. The third mechanism is the adaptation of the communication to the different stakeholders, to the different policymakers or practitioners. And we have to use different techniques specifically effective when they are combined with other techniques. The public segmentation and the adaptation of the communication to different people, the user commitment on a specific theme, the use of databases online and specific to the needs of the stakeholders, some specific communication techniques has loss and gain communication, uncertainties explanation, the use of stories and metaphors and comparison, especially when we want to use the emotional way to influence the decision. Is that the techniques we use in advocacy, for example. We can use different diffusion techniques as social media, the branding, the reminders after a first communication of research projects. And we can use a specific strategic communication, especially the social marketing, because it's very effective to influence the decision. The fourth mechanism, called interaction, is the interaction between researchers and practitioners or policymakers. We can use different techniques also, the journal club, to discuss together the results of research and their transferability in the settings. The collaboration by user commitment in the definition of research and the use of this research in different settings. We can use tutoring or mentorship, the interprofessional education, and the network on a specific theme. The main learning of this work is that the interaction doesn't work if there is not formal, intense, and combined. The interaction works when it is in a specific theme, in a specific project. The fifth mechanism is the development of skills of practitioners and policymakers. They are very effective combined with the mechanisms 6, 4, and 3. We can use training programs, especially to analyze the evidence and its transferability in the different settings. The critical appraisal training combined when there is combined with supervision tool to introduce evidence in organization processes. And the personalized capacity building, for example, the tutoring, or the methodological support to design intervention based on evidence. The last, called structures and process, by influencing decision-making structures and process. This mechanism emphasizes the importance of decision-makers' psychological, social, and environmental structures and processes in providing means and barriers to action. It's the most effective mechanisms to influence the decision and to develop the evidence-informed policymaking. We can use different techniques which have the aim to put a formal integration of evidence in the functioning of the organizations and to introduce normative processes facilitating the use of evidences. We can work at an individual level by the break of cognitive bias by advocacy, for example. And we can work at the organizational level by facilitation technique as nudge, for example, participative leadership, I talked just before, the knowledge management of data, and the use of incentives for practitioners who use evidences. The main learnings of this work is that there are many knowledge strategies we can use, but they are effective when they are combined. We know that the most ineffective knowledge strategies are the diffusion, the passive diffusion, and the non-formal interaction. And we know that these strategies are not effective. They have to be contextualized in the setting. To conclude my presentation, we have to reduce the gap between research and policy making, of course, but to reduce the gap, we have to understand why evidence-informed processes are not obvious. There are many barriers in many levels due to the properties of evidence and the characteristics of users, producers, and organizations. And these characteristics depend on the context. We have many knowledge strategies combining the best techniques in 6 categories of mechanisms: awareness, agree, access, formal interact, skills development, process, and organization refining. All these mechanisms can play out all along the cycle of knowledge transfer. In this cycle, we have 7 steps. The first is the production of knowledge, the adaptation, the diffusion, the receiving, the adoption, and the appropriation, and the use, at the least, the use of knowledge. All these characteristics refer to 3 objectives. The first is to influence the motivation to use scientific knowledge by figuring out a common language, a common interest in the use of evidence, of scientific evidence. The second objective is to set up the opportunity to use scientific evidence in the organizations by facilitating the dissemination all along the experimentation, the research, the decision-making also. And the third objective is to improve the capability of practitioners and policymakers to analyze, to integrate the scientific evidence in their organization by normative processes. So we can define that the first objective has to influence the production and the adaptation. The second objective has to influence the production, the adaptation, the diffusion, the receiving, and the adoption. And the third objective has to influence the appropriation, the use, and obviously the production by a co-production, a researcher, practitioner's co-production of knowledge. So the key components of this knowledge transfer cycle is the interaction on a specific theme, on a specific context between producers of knowledge and users of knowledge. And understand and integrate this cycle of knowledge transfer in policy-making organization and research organization is fundamental if we want to improve the social use of research. I thank you for your attention.